It's Charter Local Edition. I'm Brad Pomerance, and we are coming to you from Washington, D.C. We are joined by Steve Scalise. He is a member of the United States Congress representing the beautiful state of Louisiana, which we know has suffered some real water damage over the last decade or so. But it really begs the question about water and floods. So many different parts of our country have suffered under the weight of floods. And you've been looking at the question of flood insurance and protecting Americans from onerous flood insurance premiums.
Yeah, we have a national flood insurance program, and a lot of us would like to see a private marketplace for flood insurance, but unfortunately one doesn't exist. But there is a federal mandate in law that said if you live in a certain floodplain, you have to have flood insurance, and FEMA is the only place to get it. And so if that's going to be the law, then the program better actually work. And so the program's not really working right now.
Right.
And that's why we've brought forward a solution to actually solve the problem, get the program working again in a way that's actuarially sound and fiscally responsible.
And that begs the question, what is a flood zone? It seems as if that could be defined in so many different broad ways.
Yeah, and we're seeing FEMA come in with these flood maps all throughout the country. I had one of my colleagues from the state of Washington. She's never had any communities flooding before, and FEMA just came in and remapped one of our entire communities in a way that under the Bigger Waters Act of 2012, which is the new law for flood insurance, would have literally wiped that community off the face of the map. They wouldn't have been able to afford their flood insurance. And it shouldn't be policy of the federal government to force people, millions of people in America who play by the rules out of their homes.
So I understand that recently the House, in a bipartisan way, passed some reforms to the legislation you just mentioned. Tell us about it.
Absolutely. This is a coalition that we built over the last few months as we started hearing about all these problems with the way the flood insurance program was being implemented by FEMA. And we had a very strong bipartisan coalition of members all across the country that came together and said, we have to fix this program and make it work because it's just not working for people. And so we put together a bill in the House that actually makes the program sustainable fiscally. It's something that people can afford. It still would have increases in premiums, but in a way where people can actually pay those premiums. FEMA was giving people, there were people that were paying maybe $800 a year for flood insurance, and FEMA was saying you're now going to have to pay $20,000 a year. These aren't multi-million dollar beachfront homes. These are people that are maybe $200,000 houses for middle-class families. So we had to fix the program in a way that it actually worked and didn't force people to get run out of their houses, literally.
And as we speak today, the bill is heading to the Senate. And are you feeling bullish about its passage in the Senate?
I feel real good about where we are. We're not going to stop and rest until it gets done. But we had over 300 votes in the House, over 2/3 majority, which is a very strong vote. Look, to get anything done in the House or Senate right now, especially in a bipartisan way, is very rare. It's unfortunate that it's rare. But this was one of those rare instances where people, Republicans and Democrats, came together from all parts of the country and said, we've got to solve this problem.
I want to talk about another issue, and that is the Affordable Care Act. Continues to divide the nation. We do know that 4 million have signed up through a variety of exchanges, but there still is some effort to reform it. I'm not sure if repeal's on the table. You can talk to me about that. Where are we on this issue?
Well, it's clear that the president's health care law doesn't work. In fact, the president himself acknowledges that the law is unworkable because he continues to go and tell people he's going to give them exemptions and waivers from the law. And so just in the last few weeks, the president has said he's going to exempt or waive fines for businesses, for insurance companies. He's saying he's going to try to let people get their health plans back that have now lost their health plan. The problem is that the president can't rewrite laws with his pen. You've got to go through Congress, and this is a law that's just not working. Millions of families, millions are losing the good health care they have.
Reform?
We ought to see reform. I know as chairman of the Republican Study Committee in the House, we have over 175 members. We put together our own alternative that says, look, let's put patients back in charge of health care. Get IRS agents and Washington politicians out of the business of telling you what your health care should be. That's a decision that patients and doctors should be making, and focus on lowering costs and solving problems. We have over 120 co-sponsors of this bill, written by medical doctors. We've got to get it done.
His name is Steve Scalise. He is a member of Congress from the great state of Louisiana. My name is Brad Pomerance. This is Charter Local Edition.